In this short video, we're going to cover the basics of orthodontic photography. We're going to go over the pictures to be taken, composition, equipment, settings, and basic troubleshooting. So buckle up, here we go. When we take orthodontic pictures, the standard series is 8 pictures, 3 extraoral and 5 intraoral. We start with the facial repose, then we take facial smiling. Next is profile with the head in natural head position, intraoral center, blackout or a contrasting picture, upper occlusal. Then we take a lower occlusal, we take left buccal, then right buccal, and then overjet. Right here I want to show you in real time how long it takes to take those same pictures. So 10 pictures are taken. We start in the photo studio taking the portrait pictures. First one, like I said, is repose. We want the picture taken with the center of the face down the middle of the frame with equal spacing around both sides. Patient is not smiling. Then the next picture that is taken is the patient smiling with their full laughing smile. What you never want to say is "show me your teeth." That's a funny picture. Then what we do is we turn the patient with their nose to their left and we take their profile shot. Again, this is taken in natural head position. Okay, next we go to the mouth. We take intraoral center, retracting the lips away from the teeth. Sometimes we'll have to pull the lip out with a gloved hand. And we want 8 and 9 or upper ones and lower ones centered in the frame. Then we grab our contraster, have the patient tilt their head down, and then we shoot from above with the contraster placed behind the teeth so that we can see the incisal edges. The next picture that we take is upper occlusal with the cheeks and lips retracted away from the teeth. We don't want the lips touching the teeth. Once we finish the upper occlusal, then we'll rotate the mirrors down and have the patient pull their lips towards their kneecaps, is what I tell them. I like it when the patient places their tongue on the top of the mirror. Some patients who are tongue-tied aren't capable of doing that. Then the next picture we take is right buccal, and we shoot this picture in the mirror. We're taking a picture of the image in the mirror. You do not want to fulcrum that mirror against the bone, that will hurt. We put a retractor on the contralateral side while we retract. That purpose isn't to pull the teeth away, it's just to spread the lips apart vertically. And then the final picture that I like to take is an overjet picture. It's a mid-sagittal, it's parallel with the mid-sagittal plane. We retract the right retractor towards the ear, and the left retractor is pulled towards the kneecaps. All right, let's talk a little bit about different parts to the camera. So we're going to break this guy down a little bit. So in order to take a good dental photography, you need a couple different ingredients. First ingredient you need here is the body of the camera. This can either be a DSLR, which stands for digital single lens reflex camera, that has a little mirror that flaps up and down. That mirror is what takes the picture. The other thing you'll need is a good macro lens. A macro lens is a lens that allows you to get really close to your subject and take magnified pictures of your subject. So a DSLR body and a good high quality macro lens, we put those together. The other ingredient that we need is a high intensity macro flash. The reason why we need a high intensity macro flash is in order to have a great depth of field, we need to have a very, very small aperture. We'll go over this in our class in a little bit more detail, but a really small pinpoint hole through which the light travels we need to push as much light through that small hole as possible in such a short amount of time. So those are our ingredients. The other pieces of equipment that you'll need will be some cheek retractors to pull the lips out and forward away from the teeth. Oftentimes we can get the best angle of our teeth by using a mirror. So for example, when we're taking a picture of the upper arch, I've got a very willing volunteer here, we can use this mirror to take a picture of the upper arch, or we can use the same mirror, thank you Fred, we can use the same mirror to take a picture of the lower arch. We can also use that, man, he's losing his head. All right. There's nothing up there, dude. Okay, the other thing that we use the mirror for is to take a side view of the teeth. So you can see that there, also here. And then the last bit of equipment that we use is called a contraster. So we put this open wide, okay, we put this behind the teeth, and that allows us to get an image of those front teeth with a contraster. So again, you need a good camera, good lens, good flash, good retractors, a contraster, and an orthodontic imaging mirror. We'll go over settings here in just a minute. So when you're taking mouth shots, we want the shutter speed to be at 1/100th of a second. We want the f-stop to be at f/29, and we want the ISO as low as the camera will go. So that could be 100 or 200 depending on the camera. The reason why we want the shutter speed to be 1/100th of a second is the faster the shutter, the sharper the picture. Okay, we want it really, really fast so that there's no camera shake and no blur as the image gets painted on the sensor. The f-stop is the size of the aperture. That's the size of the hole through which the light travels to capture the image. And f/29 is the smallest little aperture that this lens will allow us to shoot. And then we're going to be in flash mode because we're shooting a flash. And then a little bit more about the settings. We want, believe it or not, we want the image quality just about to the lowest image quality that your camera will produce. These cameras are capable of shooting pictures that you can put on the side of the freeway as a billboard. But when we're working orthodontically, especially on imaging software where we're documenting progress over time, we really want the image resolution to be, if not the lowest setting that your camera will do, but the second lowest. That just speeds the transfer of information from the card to the computer and also transmitting from the server to your workstation as you're going throughout your day. So lowest setting there. I recommend that when it comes to your memory cards that you use the cheapest and smallest capacity memory cards that you can find on eBay or Amazon. There's no reason for you to keep 6 months worth of patience on one card. The only reason to have a card that's very big is for the sake of shooting video. If you want to shoot some video of your patients, you'll need a bigger memory card.
So I want to show you a couple troubleshooting tips and tricks. So first thing to talk about is head position. So you want the head looking straight ahead. That's called natural head position. You don't want your patient looking down. You don't want your patient looking up when you take your photographs. You want them parallel with the occlusal plane. Picture shows how a patient might have his head up against the headrest, whereas this one, the patient's occlusal plane is parallel with the barrel of the camera. One of the most common problems I see in dental photography is in the use of the cheek retractors. So when the cheek retractors are used, the whole goal is to pull the lips and cheeks away from the teeth. We don't want the lips and the cheeks pulled in towards the teeth. So again, when you hand the cheek retractors to a patient, they're tempted to pull the cheek retractors towards the ears. We don't want that. We want to pull the lips away from the teeth so that we see all of the teeth without any lips or cheeks covering it.
So hopefully this video has been informative to you, shown you a few tips and tricks that'll help your dental and orthodontic photography improve. It does take practice, so keep at it, take your pictures, evaluate them according to what you think they're supposed to look like using this video and other videos that you see online, and keep working at it. Some of the pictures are super easy and they don't take any practice. Other pictures do take some practice and some muscle memory to get the pictures dialed in. If you're a doctor out there, this video is especially important for your staff. You know, the doctor spends most of their time diagnosing and delivering treatment. The photography's great. I love photography myself. I take lots of pictures during the week. But the reality is that most of the pictures done in a dental office are done by treatment coordinators and dental assistants. So make sure that these types of videos are in front of your staff so that you can elevate your level of dental and orthodontic photography to its best. A picture is 1,000 words. So make sure that you're getting these pictures out in front of your patients to show them the treatment both that you have performed in the past and the treatment that you're recommending that your patients buy from you. So again, I hope you found this video helpful. If you don't already, follow me on Instagram, Curtis Ortho AZ, and my personal Instagram is straightener, STR8NR. See you on the web. Take care.